A prominent doctor and trans rights advocate admitted she deliberately withheld publication of a $10 million taxpayer-funded study on the effect of puberty blockers on American children, after finding no evidence that they improve patients' mental health. Dr. Johanna Olson-Kennedy told the New York Times that she believes the study would be weaponized by critics of transgender care for kids, and that the research could one day be used in court to argue we shouldn't use blockers. Critics, including one of Olson-Kennedy's fellow researchers on the study, said the decision flies in the face of research standards and deprives the public of really important science in a field where Americans remain firmly divided. For the National Institutes of Health-funded study, researchers chose 95 kids, who had an average age of 11, and gave them puberty-blocking drugs starting in 2015. The treatments are meant to delay the onset of bodily changes like the development of breasts or the deepening of the voice. After following up with the youths for 2 years, the treatments did not improve the state of their mental health, which Olson-Kennedy chalked up to the kids being in really good shape both when they started and concluded the 2-year treatment. However, The Times points out her rosy assessment contradicts earlier data recorded by the researchers, which found around 1/4 of study participants were depressed or suicidal before receiving treatment. The result also does not support the findings of a 2011 Dutch study, which is the primary scientific research cited by proponents of giving kids puberty blockers. That study of 70 kids found that children treated with puberty blockers reported better mental health and fewer behavioral and emotional problems. Olson-Kennedy, the outlet points out, is one of the country's leading advocates for providing gender-affirming care to adolescents, and regularly provides expert testimony in legal challenges to state bans on such procedures, which have taken root in more than 20 states. When asked by The Times why the results have not been made public after 9 years, she said, "I do not want our work to be weaponized," adding, "It has to be exactly on point, clear and concise. And that takes time." She then flat-out admitted she was afraid the lack of mental health improvements borne out by the study could one day be used in court to argue we shouldn't use blockers. A Washington Post KFF Trans in America survey found that 68% of U.S. adults are against providing puberty blockers to trans-identifying youth aged 10 to 14, and 58% oppose hormone treatments for those aged 15 to 17. Boston College clinical and research psychologist Amy Tishelman, who was one of the original researchers on the study, pointed out the obvious contradiction in withholding scientific evidence on the grounds that it doesn't match an expected conclusion. "I understand the fear about it being weaponized, but it's really important to get the science out there," she told the outlet. "No change isn't necessarily a negative finding, there could be a preventative aspect to it," she said hopefully. "We just don't know without more investigation." In a 2020 progress report submitted to the NIH, Olson-Kennedy hypothesized study participants would show decreased symptoms of depression, anxiety, trauma symptoms, self-injury, and suicidality, and increased body esteem and quality of life over time. Olson-Kennedy appeared to attempt to muddy the waters in her interview with The Times when explaining how her hypothesis didn't pan out, claiming participants had good mental health on average. She made this assertion several times, despite saying previously that 25% of the study's young patients were suffering with various mental illness symptoms before treatments began. When pressed by the outlet for an explanation for the seemingly contradictory findings, Olson-Kennedy attributed it to data averages, of which she said she was still analyzing the full data set.